So as you look, you do not have to know every single bone. Like, I'm not going to give you this rib and expect you to tell me it's the 5th rib, you know, on the left side. For most part, many of these vertebra, ribs, some of these bones, you have to know them by name, and you have to potentially know them by maybe some of their unique features. Okay. For the face, the skull, there actually will be quite a few stations on this. So because you have to know the sutures, because you have to know the skull bones and many special features, there will potentially be a station from what's out here versus turn it upside down. What are some of the bones and features from this angle? Most of the face bones, if you look at them, they don't have special features listed, so you only have to know them by name. Okay, lower maxillary bone, you have to know its name and some of its features. Mandible, you have to learn its name and special features. Okay, again, for the vertebra, the only vertebra you have to learn by name, the sacrum, atlas, axis. So C1 is the atlas, C1 is the axis. The rest of it, we're going through and learning those general things that all vertebrae should have. So they all should have spinous processes. They all should have transverse processes. They all have hole in the middle, vertebral foramen. They mostly have bodies. So that's that hard part that's sitting. All right. And then you'll go through and learn the cervical vertebra. They have a bifort, so a little bit of a split in their spinous process. They have transverse foramen. So they have holes on the outside to make room for some of these blood vessels to come through. Right? You won't see those two features in thoracic. You won't see those two features in lumbar. In thoracic, the spines point, they're a little long and skinny and they point downward. Lumbar, the spinous process kind of rounded, thickened, and just point outward. Transverse foramen or transverse processes on the thoracic have to then be connections to the ribs. So they are going to, again, kind of push out for that connection. These, they're not connected to the ribs. So they're not going to have like that flattened articulation for the ribs to try to intersect on. As you go down, the bodies are going to get thicker and bigger. Right? So there will be one station maybe with different vertebra. You'll be identify indicated feature, identify indicated process, identify indicated hole. Then you'll have a station potentially where you have to say the name of this vertebra is what? And so its name is the atlas. The name of the green one here is the axis, and then the axis, the body, the protrusion there is known as your odontal or dens. Okay. For the sacrum, you will have a station all by itself on the sacrum and the coccyx bone. So you'll have to know the base. You'd have to know the sacral foramina, so the foramen in the sacrum. You'd have to know some of the features listed there. Okay. All right. Again, with the ribs, ribs are considered flat bones. Ribs are going to curve. Ribs are going to, again, be ribs. I'm not going to ask you which rib is this. I'm not going to expect you to know it's a right or a left or it's the 3rd or the 4th rib. For the sternum, you do need to know the 3 parts of the sternum. So you would need to know the mambrium, the body, the xiphoid process. Okay, so you should be able to do that. Okay, so let's move into the skull. And again, as I tear my book, all right, so as you're doing your bones, you should be able to just follow along in chapter 7, chapters 8, and you'll be able to, 1, see the bone. And for the most part, the bone will be listed, like here, the frontal bone's listed on page 213 in gold, and then they kind of have the bone showing you in that color. Underneath, it might give you some features. The only features you're supposed to learn or know are the ones listed in your lab manual. So there may be some features listed that then you do not have to learn because they're not listed in your lab manual. Okay, so for the skulls, all right, your sutures are fair game. Now remember, in the sutures could be that classification of bones that we call sutural or Wormian bones. Remember, those bones would be technically little fragments that didn't merge with the other pieces of bone as the dermal, the fontanelle tissue, converted from dense, irregular connective tissue to bone tissue. Okay, so just to get it straight, your skull has, in this skull, it's green. This is your frontal bone. It was two bones, and they did merge. The parietal bones, you have a right and a left. There's a suture between them, right? Suture, if you cut, it's on which plane? Sagittal, so guess what the suture is called? This between the frontal and the parietal, think about the plane, frontal or coronal. So this is actually known as your coronal suture. All right. Temporal on these is purple, okay, and your occipital bone is back here. Now, your names for your sutures there are going to be, this one's lamboidal in the back, and over on the side, it's the, it looks like it's almost like square mus, so squamous, the squamous. Okay, so those are bones outside. Now, when we open our skull, you can still see the occipital, you can see a little bit of the parietal, you can see the temporal, you can see the frontal. There's another yellow, and to me it looks like a little Batman thing. It's like a little poof, Batman. That bone, and then up in here you see it's quite red. There's another bone there. So those bones we listed on the outside, plus this, and you can see it kind of on the inside here and in the eye socket. That is known as your sphenoid bone. And to me, it looks like a little bat. So when you're looking at the special features that talk about with the sphenoid bone, again on page like 215, they talk about how it has a greater wing and it has a lesser wing, because they also think it looks like a little bat or a little butterfly. Okay. The big thing about the sphenoid bone is there's this kind of dip that looks like a saddle. That is where your pituitary gland sits. That dip is known as the Celaturcica, and again, the hollow part of it is called the fossa, the hypophyseal fossa. Okay, and again, some of this is listed on page 213, and some of them is listed page 215, and then as you keep going through, page 219. All right. If you look at, again, it's green in your book, but in this skull, it's red. And then if you look in the eye socket, there's more red there. And then if you look in the nasal passageway, there's red there. So this bone kind of sits longitudinally, all right? But it's at the base of the skull, and then it extends kind of down a little bit in the eye socket and extends down towards the nasal passageway. That is called your ethmoid bone. Now, the part that's up here, again, you can look through the chapter and you'll get to it on page 220. The part that's here is known as your cribiform plate. Right here, this is where the olfactory bulb, so the first cranial nerve, it is sitting there with neurons, and they're connected to neurons that are going to push in through this cribiform plate of your ethmoid bone to be able to get into the nasal passageway. So your sense of smell is all right here in the nasal passageway, pushing up through this cribiform plate, and then your first cranial nerve is sitting right there to connect to those neurons and cells. All right? There's a little part, if you kind of rub on this bone, that sticks upward, and you can kind of see it in the picture. It's kind of this little, almost like head of a puzzle piece that points upward. That's known as your crista galli. Okay? And if you look in the nose, there will be a part of the ethmoid bone that kind of pushes in. When we eventually get to your respiratory tract, all right, your respiratory tract has these three kind of speed bump looking things. Well, those speed bumps are created by the nasal concave. And one of them, so here's that crystal galley, that superior nasal concave, all right, that first speed bump here in the floor of the cranium that right on top of the nasal passageway, this is where your ethmoid bone is sitting and creating that speed bump. Okay, so it's just this red bone in here, but when you kind of put it in perspective of, it's the bone that's kind of creating somewhat the nasal septum and has a piece pushing in to form a speed bump on the right nasal passageway, one to push on the left. It's at the top of your cranium, your skull, it's allowing the somewhat the top of the nasal passageway where brain or olfactory nerve and then neurons pushing in to like connect to sensory chemoreceptors for smell. It's all connected. Okay. All right. Otherwise, again, if you're looking, big hole in the occipital bone, the big hole that lets the brain connect into the spinal cord. So that is our foramen, because holes are named foramen. It's large, magnum. Right? You see some other holes in the occipital bone, other holes in the sphenoid bone. Those are going to be holes that allow nerves and blood vessels to come in and out. And so they'll be named, like the one in the sphenoid, one of them's a carotid to let the carotid arteries in. And then the one kind of over here with the occipital bone is the jugular to let your vein come out. Okay, so some of those holes are there. And then if you are looking in the sphenoid bone going towards the eye, there's going to be holes that then accommodate things like the optic nerve and the connections to the eyeballs. Okay. All right. There are some major kind of protrusions. There's one that's kind of a pointy protrusion on the temporal bone. And then there's one that's kind of a big rounded protrusion. Okay. You're going to find that anytime we have something really pointed, we think of it like a sword. So it's like a styloid process. And then this one that's more rounded and bigger is your mastoid process. All right. The cheekbone here, you don't actually have to learn the process, but this is the temporal bone, and the piece of bone that pushes towards the cheek into the face, it connects to the xiphoid, did I say it right? Xyloid bone. All right. Making sure I'm saying it right. Zygomatic bone. All right. So this is the xiphoid process of the temporal bone, and then this one of the zygomatic bone is the temporal process. So it's kind of telling you you're pushing to the bones. Okay. Again, most of your face bones, you just have to learn them by name. All right. So this blue is the zygomatic bone. This red is your maxillary bone. All right. The ethmoid bone on here is the red one. That leaves this green one between your maxillary and your ethmoid. That's your lacrimal bone. All right. The white up here is your nasal bone. And then we have to start getting into the mouth and the nose to try to start seeing the other bones. Okay. So to get to those views, you might need to, again, turn your page, look underneath. All right. If you can kind of tell inside, the red bone is still your ethmoid bone. So that's going to be part of your nasal concave. There's another kind of one of those speed bumps created by a blue bone. That is your inferior nasal concave. And it's its own bone. There's a little bit of an orange bone that kind of runs with the ethmoid to kind of, again, create that septum. That is your vomer. And you see it better when you flip it back over here. All right. On the palate or the back of the top of the mouth, bottom of the nasal passageway, there's a bone. It's kind of pink on here. It's shown in yellow in page 213. That's your palatine bone. Right? And you can kind of see in that inferior view, the blue, the inferior nasal concave, the orange, the vomer bone, and then you see how it all interconnects to the palatal bone, then the sphenoid bone, and the ethmoid bone. All right. Now, because there's a lot of different bones connecting, if you look at the skull that doesn't have, it's hard sometimes to tell where one bone ends and one's bones begin. So I will try to use in-person color skulls, and in your lab practical, try to use the pictures that have color differentiation. Okay. Luckily for most of these face bones, you don't have to know features. However, if you turn the page, you do have to know special features, especially for the temporal, the frontal, sphenoid, ethmoid, occipital, because there's some big features to learn. Parietal, you don't have to learn special features. All right. The other big special features you have to learn for a face bone is your mandible and a little bit on your maxillary. Okay, and again, some of these skulls, the mandible comes off. All right, so when you're looking at the mandible, again, there are more things listed in the picture than are listed in the lab manual. So you want to go with the lab manual. Okay, so we know that what's the chin called? Mental. So then this little protrusion here of bone is actually known as your mental protuberance. Okay. We know that processes point up. All right. And we're going to learn that this back process that articulates, this is our TMJ joint, our temporal mandible juncture. Okay. That is going to be your condylar process. And then the pointy kind of one up front that's not quite as thick, not quite as pronounced, that is going to be your coronoid process. And what's interesting is you have another coronoid process in your body that looks completely different, but it's on your radial bone. So sometimes, again, coronoid gets used multiple times in two different places. So in the past, I did one question. I was like, name one of the bones that has a coronoid process. And you could say radius, or you could say mandible, because they're both correct. All right. There's a hole over here near the chin, mental foramen. Okay. Some of these things that are hard to put stickies on, again, I'm going to stick to big pointy things, but I can put a sticky around holes, because I can point to the hole, identify the hole. All right. Those are going to be some of the better ways to, as you do your test prep, make sure you know what they mean. Okay. Let's see. The body of the bone here, and then as you get towards a little bit of a protrusion or area here, this is the ramus, and then the indentation between the two processes is known as the mandibular notch. So if I stick the sticky in this kind of circular indentation, I want you to tell me the notch. If I stick it right here, I want you to tell me the ramus. And as you're reading, you'll go through and it'll tell you kind of like, oh, it's named this because this is what it is and this is what it does. So it doesn't have the mandible. So it talks about the joints, and then it tells you like the ramus is the ascending part from the body towards these two processes. The condylar process is where you join the TMJ joint. The coronoid process is an insertion point for a muscle, all right, and it comes a little bit anterior. Okay, the notch is the depression between these two processes. So it'll tell you some of that information in there. Okay. All right, so we've got through skull bones, questions, face bones, questions.
What did you say, the wormian?
Oh, vomer? No, wormian. Wormian are, so in chapter 6, at the very beginning of the chapter, it talks about, and in the slides as well, it talks about there are 6 categories of bones. So this was figure 6.1, and it talks about what's known as sutural bones, letter A there. So, and it shows you a bone in the suture that would be like this big kind of circular bone between not the parietal and not the occipital. So in theory, there are potentially, a suture is bone, connective tissue, bone. In theory, there might be little bone fragments that formed that never merged with the other bones. And so they're microscopic, so they're not like in this picture, these huge bones. Second, they're not uniform. Like you might have some wormian or sutural bones right here, and then someone else might have them in different places. So we don't necessarily always have one always in the place. Now, for the sesamoid bones, everybody should and would develop this nice big patella. So that's like the one bone that's named. Technically, in your elbow, like it could be that part of the olecranon here is potentially somewhat sesamoid, but it merged and joined, so that's why it's not a floating bone. But if you look at deer and antelope, they kind of, in their legs, have these sesamoid bones that form at their knee joints or at their different joints. Okay, so for the category of bones, like this is flat, these are long, these are long, these are short. As you go through, there's really, for sutural or wormian bones, it's hit or miss, it's be microscopic, and then for sesamoid, there's really only the patella for us to talk about. Okay? Okay.
If we were labeling the TMJ, would you rather it be TMJ or actually?
Technically, I wouldn't ask that.
Okay.
The joints listed in your lab manual. I would just ask you, what is the process, or what is the indentate? Like I would ask you those features in the bone where that joint's made. So what's the process of the mandible? The condylar process. Okay. All right. So again, everything on here, I'm not going to go through every little piece and point. Make sure whatever's listed in your lab manual, you can find on the bones or find in the pictures. Okay. We've gone through, all right, we've gone through the vertebra. Again, as you're learning your vertebra, so figure 718, A and C, just the major parts of your vertebra, that's what you want to, when you grab vertebra out of here, all right, you want to be like, okay, which is the spinous process? So that should be the one that when the vertebra is sticking posterior. What are the transverse processes? Again, those would be the two going more lateral. What's the hole in the center called? That should be vertebral foramen. What's the flat part that, again, is as you go down getting bigger because it's holding more weight? That's considered the body. Okay? If I ask you which of these represents a thoracic or which of these represents a lumbar, and I have vertebra out, you would probably say this is probably more lumbar, this is more thoracic. And you can see the angle, you can see the spinous process is more pointy. This one, again, less of an angle, flattened out. The transverse processes have some flat edge to let that rib articulate versus these are just more pointy for muscles to attach. Okay. I would not be like, which vertebra is this? I wouldn't expect you to be like, that's L1, like that. At that level, we're not going. So I wouldn't be like, what's vertebra is this? You know, I wouldn't be like, oh, it's T2. You know, like I'm not going to ask you those kind of questions. So which of these represents what would be considered a lumbar vertebra? Which would these represent a cervical? And I'll give you A, B, and C, and you just pick one of the letters. And then which, identify indicated feature, identify indicated feature. And again, using the features from page 718, page 230, what is listed in A and B. Okay. Now, for the atlas, I don't have the axis, you would need to know these by name. And I would tell you, not by letter and number, what is its name. And you need to know this is the atlas, and then the other one is the axis. And then for the axis, you need to know that the body makes that protrusion upward, and that's known as your dens or odontal process. Otherwise, these are still transverse, spinous process, vertebral foramen, transverse foramen. Okay, so everything that you can in general find. All right, when you move to the sacrum, so you do have the coccyx would be the attached few bones at the bottom. You know that the holes in there are sacral foramina. All right, you would want to know the base. You would not want to know the curve that curves with the coccyx bone is the sacral curve. There's transverse lines, whatever is listed in there, you would want to know. Okay, so there's like the ALA, ALA, that's not listed in the lab manual, so you wouldn't have to know where that is. Okay. All right, this will be a station. So vertebra, a station on some naming of the vertebra and identification of their groups they belong to. Then a station on the features and the parts, and then one on the sacrum. Okay, for the skull, we have features, names, right, on most of the skull bones. So there's usually two stations. I've got to do one on top, and then I got to turn one under or open it up to get to the sphenoid and the ethmoid and the bottom of the occipital. And then for the face, you'll at least have one station with 4 to 5 questions on identify facial bones. Mandible, ethmoid, sphenoid, occipital, or temporal, usually that's by itself. Okay? And then you'll have rib and sternum, and there'll be probably 1 or 2, 3 questions on that. All right, then you move to chapter 8, and you start getting into the long bones, shoulders, hips, and everything that comes off of that. Okay? For these, there will be, I think it's 3 questions where I will potentially give you a bone, and I'm going to ask you if it's a right or a left. So I usually ask it around the scapula, the humerus, the hip, or the knee, femur or tibia, and I can ask it with, because you have 2 joints listed you have to learn, so a shoulder joint and a knee joint. So you would potentially need to tell me if this is a right knee or a left knee, or a right shoulder or a left shoulder. So you don't have to worry about maybe labeling some of these, but some of these appendicular bones, appendicular features, you will expect to have to know right or left. There will be at least 3 questions where it's a 50-50 guess. It's the right one or the left one. Okay? All right. If I don't ask you specifically if it's a right one or a left one, you don't have to tell me. Okay? Okay. So as you go through shoulder girdle, shoulder joint, your clavicle, and as we kind of today's lecture, we talked about endochondral ossification versus intradermal. This is intradermal along with here and the skull, right? So this is made from dermis tissue, your clavicle. Your clavicle, your scapula, and your humerus come together and they form kind of that shoulder joint, right? The movement of the shoulder is mostly the humerus in that scapula, glenoid fossa action, right? So flexion, extension, hyperextension, abduction, it comes out, adduction, it comes back. Okay? The scapula, as you can see, you want to know right and left. Glenoid fossa, acromial process, coronoid process, or coracoid process. Here's the spine, and there's a little bit of a shelf up here, all right? So up in here is the supraspinous fossa. Under is going to be your infraspinous process. This is going to be your lateral border, closer to the humerus. This is your medial border. Here's your inferior angle right down here. Okay. So again, some of the things listed on page 247 might be more than what is listed in your lab manual, but make sure whatever's listed in your lab manual, you know. Okay. All right. As you get into the shoulder joint, this is fair game, and you do need to know, I think there's 5 or 6 ligaments listed. Some of the ligaments you can't put stickies on because some of the ligaments are between the humerus and the glenoid. They attach. I can't put a sticky on that in this model. Okay, but the ligaments I can put a sticky on are the ones that are connected from the clavicle to the scapula to the humerus, scapula to itself to create stability. And most of the time, the ligaments are going to tell you what they're connected to. So there's a clavicle acromial process and a clavicle coracoid process, right? And then there's an acromial coracoid connection as well. Okay, so you just have to learn the ligaments, and again, they kind of tell you where their name is. All right. If you have to try to tell right and left, remember the clavicle is anterior, scapular is posterior. So you would want the humerus to be lateral. This would medial. So this is a right shoulder. If you only have, and I wouldn't give you the clavicle because that one's hard. If you only have the scapula, you want to see the spine posterior. Okay. You want that inferior angle to kind of point medial, and so this big rounded is medial, here's lateral. So again, that would be part of how you would tell this is a right scapula. Okay, if you get to the humerus, it's actually easier to probably look at the distal part of the humerus to be able to tell what's medial and what's lateral. And remember, thumbs are always lateral, pinkies are medial. So then you want to make sure you have the skull or the bones lined up that way, okay? All right. As we get into the humerus, there are no trochanters on the humerus, and the humerus is not a femur, okay? Where do someone, if you put them in person out, do these two bones look alike? No, but in a 2D picture, all right, these two bones, you don't get the size, the shape. So someone always labels this a humerus and this a femur. They get them confused. Okay. All right. So femur is always going to have that extended neck. The humerus doesn't really have that much of a neck. Femur is going to have these very large kind of processes, and part of the reason why there's a lot of pull on them, big muscles, lots of strong muscles. So again, they are going to have trochanters, whereas these are just going to have two turbuckles. So they give the processes, they're still processes, it's just they give trochanter processes, so a little bit more of a stronger name, turbuckle. All right, when you get to where this is going to connect to your radia and your ulna, okay, the bigger hole should be posterior because the ulna has that hook. And to get my elbow to be able to extend, I want room for that hook to push in. So the bigger process or fossa or cave is where the ulna is going to insert, and that's where the olecranon process inserts. So this is the olecranon fossa. There is a little kind of cave in the front. So it is known as your coronoid fossa. Okay, and so if you orient it like this, you can now tell the rough edges of the humerus are out here. This is where the deltoid is going to be, again, like your shoulder pads sitting. And when you pull it, it's going to pull out. So it should make sense that all the roughened processes of the bone should be towards the outside to move that bone out. All right, so then when you look here, this is facing towards the medial side. So this is your medial condyle or epicondyle because it's on the outside. So then this part, rounded surface here, is going to be your medial condyle, also known as your trochlea. This side will be your capitulum or your lateral condyle, and then outer lateral epicondyle. All right. Okay, get to the radius and the ulna. The ulna is bigger at the elbow joint and it gets skinny at the wrist. It's the medial bone. The radius is that circular head, because what can you do if I hold my wrist? Can I move my thumb over? That's supination and pronation. That's because the radius rolls. So there's that kind of rolling feature of the head of the radius, right? The radius is thicker at your wrist, okay, going towards that thumb, all right? These little pointy processes, they're mostly known as styloid processes. The styloid process of the radius, the styloid process of the ulna. So like the pointy one up here at the temporal bone, styloid pointy processes. All right, when we get to the wrist, there's 8 bones. Okay, one of them is this little over here. It points out, that's the pisiform. If you count, 4 bones are closer to the radius and the ulna, 4 bones are closer to the fingers. So you just have to learn, and there's acronyms out there. After we do those carpal bones, I'm not going to ask you about the fingers. I'm not going to ask you about that, so you don't have to worry about that. Okay? All right, so that's the right and the left side. Going towards our hips, technically, your pelvis is 2 bones. They are known as your Coxa Bones, and they are 3 bones that merge together. The ilium, up front here is the pubis, back here is the ischium. When you sit on your butt and you feel your boniness press into the seat, that is your ischial tuberosity. There's a big hole in this bone. That big hole is your Vertebral Foramen. The cavity that's created, so this one was the glenoid fossa. This cavity that the femur inserts into is known as your acetabulum. Iliac Crests, and again, in the people that do the underwear, you want to see their iliac crest, right? And then you see how the underwear sits on them. Okay? The piece of cartilage between the 2 pubis bones, that's your pubic symphysis. And remember, in females, the bowl that's created by the 2 bones is going to be wider to accommodate birth. And that pubic symphysis towards the end of pregnancy under high progesterone amounts widens and softens to even try to create more opening. All right, males, there's a narrower circle, narrow there. So there is anatomical differences between the hips of a female, the pelvis of a female, pelvis of a male. And that's one of the ways when they find remains of a skeleton, you know, before they could DNA test, they would look at the hips to try to figure out if it was a male or a female. Okay? And it talks about that on page 255 in your book. All right? Again, moving into your femurs, there's kind of a big knuckle back here. That's the lesser trochanter. And then if you think about it, this kind of big knuckle up here is known as your greater trochanter. It's still a process, but we just give it a special name. The only place you have trochanters is on the femur. Okay? When we think about the head of the femur, the front part, if you try to, head of my femur, face the front of my femur out, that's how we externally rotate. And if I take that front of the femur, pull it back, that's internal rotation. So the femur can still do flexion, extension, hyperextension. It can be adduction, abduction, and then it can be external rotation or internal rotation. Okay? All right. Femur is the proximal bone. Tibia is your distal bone at the knee joint. The tibia is always the medial bone. The fibula, and the fibula has an L in it, it's the lateral bone. So when you look at a knee joint, the fibula is always lateral, so this would be a right knee. Okay? And then the tibia is the medial, and we'll go and connect at the foot here with your tarsal bones. All right, your tarsal bones down here. Same thing, you got to know the calcaneus, the talus, the cuboidal, the navicular. Don't have to worry about the toes. So learn your tarsal bones. All right, fibula, tibia, fibula, femur, coxa, bones. So station, two bones together, station, and then your tarsals. So that's 1, 2, 3, 4 stations on the leg. 1, 2, radial and ulnus together, 3, wrist bones, 4 stations on the arm. You will have a knee joint. You will have your shoulder joint. Now, the knee joint, the quadriceps of your front of your thigh, that tendon connects muscle to the patella. It technically keeps going, and then it becomes the patella to the ischial or the tuberosity here, the tibial tuberosity. Technically, it's bone to bone. So it's called the patella ligament. Now, we merge those together, and we sometimes call it the patella tendon. Technically, from here to here, it's a tendon. Technically, from here to here, it's a ligament. Patella's in the middle. But the correct name is quadriceps tendon, patella ligament. When you had my ACL done, they took part of here, so part of the connective tissue here, and they made me a new ACL. So I thought I had my patella tendon taken out, but it's not. It's actually the patella ligament. Okay? This is the medial, because again, tibia and fibula, femur. So this is the medial collateral ligament. When they talk about people getting their MCL hurt, from the femur to the fibula, it's lateral. So that's the lateral collateral ligament. They're also known as the tibial collateral ligament and the fibular collateral ligament. Okay? This piece of tissue that the femur is sitting on and keeping the femur and the tibia from pounding into each other, that is your lateral meniscus. Over here, that is the medial meniscus. Now, to see the ACL, you have to kind of open up. And the ACL, if you kind of bend and open up, it starts at the anterior of the tibia and connects to the posterior of the femur. So it starts at the anterior, that's why it's the anterior, and connects to the back, and it runs through the center of the joint. So anterior cruciate ligament. On the back, posterior cruciate ligament connects the posterior of the femur to the posterior of the tibia. Okay? I think that's pretty much everything. Okay? So you have this week, next Wednesday, and then the test. Okay? To get through all this material. Again, I don't need to be really nitpicky on what I pick because there's so much of it. I can just pick the most obvious things on every bone, and you still have 300 things to learn, right? And trust me, I try to pick some of the most obvious things on the bone because that's the easiest things to put the sticky on. Okay? And you get about 60 to 70 questions going through this. If you plan to be in orthopedics, in exercise physiology, if you're planning to do occupational therapy, physical therapy, this is your wheelhouse because you're trying to assess what joint, what tendon, what muscle, what movements are causing pain or issue, and you try to fix that. So if you like this, then you might want to be a nurse for the orthopedics, for the OTA, PTA, you want to be on that service, the rehab world. If this is eye-pokingly miserable, you do not want to go work in those services. Okay? So part of how this class works is we show you these organ systems, we throw you these things to memorize, and if this is the miserable part, then let's not try to go work in that side of the business where you need to speak this language and deal with this every day. It's rite of passage. Everybody has to learn all their bones and muscles, and then the minute you're done, you can forget about it if you're going into mental health type stuff or neurology, okay? And then those people that hate the neurons and hate the muscle or hate the cranial nerves and the spinal nerves, then don't go into nervous system practices. Don't go associate with that, okay? Got it? All right, I'm going to stop the recording. Do you guys have any other questions?